Minister, three-quarters of the speech and language therapists in County Roscommon and County Galway are currently involved in contact tracing. Before the lockdown, there was a 4-year waiting list just to access speech and language therapy in counties Roscommon and Galway. This now means that a preschool child referred to the speech and language services might not get support before their Holy Communion. At present, 1,049 children in these two counties are waiting for access to speech and language therapy, and three-quarters of our speech and language therapists are directly involved in contact tracing. This is not a good use of very scarce therapy resources. And it's not just speech and language therapists. I've received reports that occupational therapists, physiotherapists, audiologists and podiatrists, to name but a few, highly strained staff have been redeployed since COVID-19 lockdown and remain redeployed into other areas within our health system, while the waiting lists for vulnerable children just mount and mount. And this is not just happening in the West, but I've also received reports of it happening in Westmeath, Laois, Offaly and Kildare. Minister, how can it be that it has taken months after these staff were redeployed before any attempt was made to recruit contact tracers? What is even more appalling is the fact that the therapists involved in the Galway-Roscommon ASD unit, based in Athenry, were prior to COVID-19 involved in the reconfiguration of that service, which was to be completed by January of next year. But it wouldn't surprise me that COVID-19 will now be used as an excuse to drag out this process instead of doing this reconfiguration during the lockdown when they weren't seeing children, again adding to delays. But what does this mean in reality? Take Liam, who turned 5 today. He had his first block of speech therapy sanctioned in March, but he had no session before he started school this September because his therapist has been redeployed into contact tracing. Liam wasn't sanctioned an SNA in his school either, so his older sister in the same class must now translate for him. And all because nobody seems to have been trained into contact tracing after the first wave of infection months ago. In fact, clerical staff across government agencies and members of the Defence Forces have been taken off contact tracing and sent back to their previous jobs, but not frontline therapists who could help Liam and make sure that his older sister Ava could be a normal first-class child and not acting as an SNA. Minister, I want this to stop, and I want this to stop today. We want these therapists put back doing the work that they should be doing today. I don't even want you to wait until next Monday for this to happen, Minister. This needs to happen immediately. It should never be the case that these staff were redeployed in the first instance, and after the first wave of infection, they should have been the first staff sent back to do the frontline services instead of sending back the clerical staff and having these staff still tied up in contact tracing.
Thank
you, Concorla, and I wish to thank the Deputy for raising this very important issue in the House today and in preparing for and responding to COVID-19 and to fully align with public health guidance as recommended via the NEFIT, the HSE and its partner service providers put in place a range of measures. These included the prioritisation of vital residential and home support services, whilst curtailing or closing certain services such as day services, as well as certain clinical supports in order to prioritise essential public health services at CHO level and ensure continued delivery of the reference residential and home support provision. Effective redeployment of health service employees was a core element of the response to the HSE to COVID-19. Hospital groups and community health organisations temporarily redeployed staff to support their businesses' continuity plans, emerging services developing in direct response to COVID-19 and in response to the health and availability of staff in their own organisations. Having said that, some services continued with therapists, including speech and language therapists, working with service users and their families remotely and using technology in new and effective ways. The HSE National HR Strategic Workforce Planning and Intelligence Units collects information regarding the redeployment of some staff. Many grades and categories of staff, including speech and language therapists, were redeployed, and some continue to be redeployed to other services such as helplines, contact tracing, testing, public health, service support and other areas. The presence and threat of COVID-19 in Ireland is ongoing and has resulted in significant challenges for service users, their carers and families, and for service providers. During these challenging times, disability services and support such as residential services, day services, home supports, personal assistance supports, respite services and children's services were either suspended or delivered in alternative ways in line with public health guidance. In the absence of regular scheduled day services, respite supports and multidisciplinary supports, CHO and service providers have tried to maintain services that can be delivered safely, providing outreach and telecare solutions, using technology where possible, and using creative and innovative models of care to support service users, both adults and children. The HSE was also mindful of the will and preference of people in terms of receiving services, and in certain instances where personal choice was made, put these services on hold. The HSE acknowledges that during the current COVID-19 pandemic situation, it has not been possible to maintain full service. It has therefore been difficult to complete clinical assessments or provide interventions while maintaining social distancing and meeting health and safety requirements. The HSE is aware of the numbers of children and adults waiting for therapy services, as you outlined, Deputy Naughton, including speech and therapy, language therapy, and is fully cognisant of the stress that this can cause to families. One of the key priorities for the HSE is to improve waiting times for therapy services. In respect of revision of disability services and the context of the Government Resilience and Recovery Framework 2020-21, the HSE regards the provision of disability services as essential to maintaining a response to people with a disability. This means that therapies, including speech and language therapy, whilst being delivered in new ways, will gradually be reintroduced to children with disabilities. It is a priority for the HSE to release redeployed staff and back to their sustainable grade, and a national recruitment campaign is underway to retain testing and tracing resources in order to deliver this. 50% of the staff redeployed at the beginning of the pandemic have, as you rightly said, have already returned to their substantive grade. Thank you.
Minister, with all due respect, and I know this reply is presented to you by the HSE, but Minister, that's farmyard manure. That's what that is, because it doesn't address any of the issues that I have raised with you here and that have been I've given a week's notice in relation to this specific issue. Now, Minister, in relation to all of these therapies, all of the private providers are back delivering these exact same services and charging for them for months at this stage, but not the HSE staff. And with all due respect, 50% of the staff have not returned to the frontline services that they were providing prior to this. As I've already put on the public record here, 3/4 of the speech and language therapists, physiotherapists, occupational therapists, all of whom are still involved in contact tracing instead of the job that they should be doing. And Minister, I had the opportunity here in the House on Thursday to bring this up with the former Taoiseach and current Minister for Defence, Simon Coveney. And he told the Dáil here on Thursday that the Defence Force staff would be made available if the HSE asked for them in terms of providing contact tracing. He also told the House here on Thursday that only 24 of the 647 applications received from former Defence Force personnel to re-enlist to help out during the pandemic had been approved due to ineligibility criteria such as age and other criteria. Surely, Minister, some of those 623 staff, and I'm sure many more staff that have answered Ireland's call, and staff who have already left the HSE, would be willing to come back to help out so that children could learn to talk, so that children could learn to walk, so that our children could have ordinary, everyday lives just like their brothers, just like their sisters, just like their friends and neighbours. And surely it's not too much to ask that these very valuable therapists would be sent back to the job that they should be doing at the front line, treating children on a day-to-day basis instead of picking up the phone. Thank you.
Thank you, and I would like to thank the Deputy for raising this issue, and the Minister does acknowledge the significant contribution of health and social care professionals to the COVID response, and in particular the urgent requirement for testing in the community services. And I know myself in the Department of Health, a lot of the various teams are still working on COVID. The HSE have put a plan in place to stabilise the testing workforce to release staff back to their substantive roles. However, the rising number of cases and the requirement of the HSE community services to respond to meet the evolving priorities. There is a fine balance to be struck between the competing priorities of responding to COVID, as you are very, very well aware, and restarting the services temporarily paused on the onset of COVID. I will bring your forthright and helpful advice to the Minister when I meet him tomorrow.
The Army stand available to do this, and they're the ones that should be used.
There are, however, a number of measures being put in place to manage such competing priorities. For example, a national requirement campaign for dedicated testing and tracing resources. We do expect that such measures coming in place will assist in our ability to meet both COVID and non-COVID demands. HR in community operations has been in dialogue with trade union partners regarding the matter and has agreed to progress a roadmap for the return of all staff and their substantive roles as the new staff come on stream in a coordinated way. So I do appreciate Deputy Naughton's advice, and I will bring it to the Minister. However, sometimes there are a lot of other issues, and I got involved in politics first. I was told the fight's never what the fight's about, and sometimes there's other issues that maybe we're not cognizant of, and we are in the middle of a very, very dangerous COVID situation, and the situation is evolving, and what was pertaining last week may not be pertaining this week, and we see in our own areas the rise of COVID-19. So I would certainly like to congratulate all the staff and the frontline staff of the HSE for all the work they've done so far. Thank you.